integrative physical therapy and to explore how integrative approaches to PT and movement are kind of essential components to an integrative pain care team, and experience a brief practice of integrative physical therapy for pain care. I wanted to start off the talk with this image that comes from an article that I recently co-authored for the Journal of Physical Therapy and Rehabilitation around this idea of setting guiding principles for integrative PT. Right now, integrative physical therapy is not a board-recognized specialty, and so it's kind of the Wild West. Like, anyone can call themselves an integrative physical therapist. There's no standards for that practice. And so myself and my co-authors got together, and we took about a year to kind of talk and collaborate and envision what it was that we thought were the core principles around, if you're going to be an integrative physical therapist, what does that mean? And so these 5 principles are what we came up with as the 5 elements that you need all 5 of these in order for it to be, in our opinion, to be considered integrative physical therapy. And we thought of this as a starting point, not an ending point. So over the course of time, these guiding principles might evolve or change, or someone else might publish something telling us that these are terrible and they've got better ones. But for now, we just thought we would start the conversation with these 5. And this image that I created for it is trying to do these overlapping circles to show that these are not distinct principles, that they all interrelate, and that they're not, the borders around each of them are fuzzy. But I wanted to talk about what those 5 principles are in a little bit more depth. So therapeutic partnership, which is often a core principle of any integrative healthcare modality or specialty profession, which involves a deep listening between the patient and the provider, and even a breakdown of the hierarchy between the two, so that it's more of a collaboration and that the patient gets to be the expert in their own experience. And the provider is more of, sometimes I joke with patients that I'm not even really a healer when it comes down to it, that I'm more of like a garbage collector is sometimes how I describe it, or like a path clearer, like someone, the patient is going to be walking down their path of recovery. They do the healing. They're actually the healer. All I'm doing is I'm like a flashlight, like helping them to find their way, or I'm the garbage collector, like clearing debris along their path, making it easier for them to walk down the path, but they're the healer. So they're the one doing their own healing. And this evaluation as treatment, I'll talk a little bit more about that later, so we'll leave that for now. Living systems theory is this idea that we are all evolving integrated system beings with all of the systems of the body that in medical school we're taught them sort of individually, like here's our class on the cardiovascular system, here's our class on the nervous system, the musculoskeletal, as if these are separate things. But in an integrative model, these are all interconnected and ever-changing, so that our internal state is dynamic and inherently interconnected. In physical therapy, one of the main ways that this comes up is in the musculoskeletal system, which I was taught in a kind of joint muscle isolated fashion, where we learned that the bicep muscle, flexes the elbow and flexes the shoulder a little bit, and that's what it does. As opposed to when we look at things in more of this myofascial web system, we're understanding that the body moves and functions not as isolated joints and muscles, but as an interconnected system that involves not just muscles and tendons and bones, but also involves the fascia and the connective tissue and the nervous system, that all of these things are working together to create this movement at the elbow, that it's not just a joint, isolated joint muscle phenomenon. And also the integration of the autonomic nervous system as central to our care. So knowing that where someone is at on their stress response and their reactivity is going to influence everything about their experience in physical therapy, and particularly when a person is experiencing pain, and particularly when they're experiencing persistent pain. The whole person health model is, again, something you see all the time in integrative care, with this idea of not just looking at one aspect of a person, but trying to widen your lens to encompass as many aspects of the person as you possibly can, which includes mental, emotional, spiritual, environmental, lifestyle, social determinants of health, all of those things are part of our care plans. Movement as an integrative experience, again, is something that's really unique to integrative PT and how we approach movement. That movement is not just about, the conventional benefits of movement that we think of. It's good for endurance and energy and metabolic health and, musculoskeletal health and all of that balance, things that are conventional. We agree. Those are all great components of movement, but also we look holistically as movement as medicine, of knowing that it has a profound effect on our mental health, a profound effect on cognition, our ability to learn, cancer prevention, a whole host of other benefits to movement that we really leverage in integrative PT. We think of breathing as a movement practice. And that's not this little spoiler alert. That's one of the practices that we are going to do together as a group later in this session. And then really embracing cultural mind, body, spirit movement modalities and practices. And yoga is the one that I'm most trained in, but there's a whole host of other. You can look at Tai Chi, Qigong, forms of martial art, forms of dance, all as these kind of mind, body, and cultural movement practices that are often a really core component to integrative PT. And then the last of the guiding principles is a really fun word to say, and I'm never sure if I'm saying it exactly right, but I call it salutogenesis, which is this idea of thriving. So not just looking at what makes us sick and sort of the causes of injury and treating the things that are wrong with us, but it looks at how can we live our best lives? How can we maximize wellness? How can we really reclaim joy in the healing process? So those are our guiding principles. That's what we saw as kind of the most important components to integrative PT. But then at Hennepin, we have a really unique PT specialty, integrative PT specialty, which is unlike anything anywhere else in the world. I've never heard of a safety net hospital or even a hospital system having an integrative PT specialty that's as supported as ours is and as kind of entrenched in the system. We're really a recognized specialty within Hennepin. And there's a whole story as to how it happened, which is there usually is behind these things that are very innovative and new, that there's kind of a good story behind where they came up. But if we have time at the end and anyone's interested, I'll tell the story. But for now, I just wanted to focus on the current state, not our history of what we are. So right now, there's 5 of us that are practicing as integrative PTs at Hennepin. And this is what we put together collaboratively, our group, as our description of what we are, our values, our mission, and kind of some of the mechanisms that we use to achieve our mission. But you'll see here a lot of similar stuff from those 5 guiding principles, that we focus on maximizing the body's self-healing abilities, regulating the stress response, exploring root dysfunction, and paying close attention to these connections between the body, the mind, and the spirit through movement. And when we say spirit, we don't mean any religious practice. What we mean is that deepest self, that kind of connection to your deepest core values and your deepest sense of who you are. And this is another image that I created for the Guiding Principles article that I think describes really nicely in picture form what we do as integrative PTs. And I think it describes in picture form what a lot of integrative providers do. It goes beyond physical therapy. But the tree image is representative of sort of a person comes in with a symptom to seek healthcare. Maybe let's say it's a sore shoulder or something like that. So that would be the branch or the leaf level of care. And then if you want to go deeper down to the trunk, you're looking at the whole person. So looking at all the different parts of their life. Maybe they can't sleep because of their shoulder. Maybe they're having a hard time reaching up overhead, so you're looking sort of functionally, but as well as, if they can't sleep well, that might be affecting their relationships with other people. So kind of widening the scope to look at that whole person approach to it. And then going into the roots to look for the root causes. And this is where we'll do a deep dive into lifestyle, into what's your nutrition like, and What were the conditions where the injury happened? Is there, a safety concern that we need to address? Things like that. Is it a balance issue if there was a fall? So looking deeper into those root causes. And then going out into the soil and the air, which is where we hit the environment, the world around you that contributed to whatever this injury is or this issue is, the community, the people around you, society, social determinants of health, and this idea of the exposome, which is a term that relates to the combined exposures that we are, things that we're exposed to throughout our life that either bias us towards or against health. So exposures that would bias away from health would be like environmental toxins, but it would also be an exposure, something like the experience of racism is an exposure that goes into our exposome that biases us against health, or any kind of experience of marginalization, poverty, or adverse childhood experiences. Things like that are all exposures that go into that exposome that, again, influence whatever we're getting at that branch or leaf level, whatever those symptoms are. So integrative physical therapy, or physical therapy in general, is very well suited to be part of an integrative team. And it's kind of interesting because PT itself, physical therapy, is traditionally a part very entrenched in conventional care. And I had this conversation maybe a year ago with one of the chiropractors that I practice alongside, and he said, like, I've spent my entire career as a chiropractor, like knocking on the door of conventional medicine saying, please let me in, please let me in. And I was like, well, I think I'm on the other side of that door in conventional medicine, like looking out at integrative medicine, being like, please let me out, please let me out. And we're like meeting in the doorway. So PT is traditionally part of conventional medicine. However, there are things within our medical system and within the way PT is envisioned in America that makes it actually a really great opportunity for integrative care. And one of those is time. So PTs do time-based billing. So if I see 4 patients for 15 minutes or 1 patient for an hour, I bill out the same. It's considered the same kind of purposes for billing. And so it allows us to schedule longer visits, whereas physicians are so often just blasted by our system to try and see more patients, shorter visits, shorter visits, shorter visits. But in PT, we don't have that same stress. So that's amazing. Lucky us. And that again leads us to be able to practice this integrative care that needs time. You can't do this in a short visit. Our scope of practice also allows us to do a lot of the lifestyle and wellness coaching that, again, a lot of other providers may not have time for. We can bill for self-care and education is one of our billing codes that we use routinely. So again, that wellness coaching can be part of our plan of care. And we can also, within the autonomic nervous system, another billing code that we have is neuromuscular reeducation. That's another common billing code in PT that is traditionally used for balance activities, but it's about how our nervous system relates to our musculoskeletal system. So the autonomic nervous system is a huge part of that. So activities like meditation, like breathing practices, like yoga, or even manual therapies that stimulate a relaxation response in the body, those are all part of neuromuscular reeducation. So again, it's built into our scope of practice that we can be doing this work. And there's a movement within the PT community to really look at mental health and how physical therapy has a role within mental health care too, particularly around the research that's very compelling around aerobic exercise, aerobic forms of movement, and depression, which we'll talk about a little bit more later in the talk. And then I also just wanted to, again, name that these complementary and integrative medicine modalities, the CIM modalities, allow for a lot of dual practice. And there are PTs all across the world that are sort of co-practicing yoga therapy and physical therapy, acupuncture through dry needling, meditation practices, the hands-on practices of myofascial release, craniosacral therapy, things like that are also kind of within this scope of physical therapy. And yeah, somatics is another one. There's a lot of mental health providers that are moving into that role of somatic experiencing, of how our body experiences trauma within our bodies. And there's movement practices within the world of somatics that, again, physical therapists have a really unique position to influence mental health alongside physical health through the somatic work. I included this image here. This is the front page of a wellness packet that patients get when they come to integrative physical therapy. And so you can see, again, this reoccurring motif of these intersecting circles. I couldn't figure out, I'm not a good enough graphic designer to figure out how can each circle touch every other circle. So I was just like, well, I'll just put them all into one big circle, and it's implicit that they all affect each other, that they're all interrelated. But again, when it sets the expectation for patients when they come to see us to know that their plan of care is going to be this whole person plan of care, that it's going to involve, it could involve like anything within these circles, from hydration and nutrition to kind of emotional, spiritual well-being, social determinants of health, lifestyle, sleep, pain management, movement. All of it is interrelated and is part of the care plan. And the idea behind that, the deeper meaning for us, our own kind of mission and goal, is to really change the world through this work. And again, not that we are thinking that we're going to end like disparities in our community through this work, but I think we all, the integrative team at Hennepin, all sees ourselves as one small part of changing our world and changing our community through offering what we consider to be this very meaningful, deep level of care to people who experience a greater burden through that exposome, through their environment. So people who have more disparities when it comes to income, experiences of marginalization and historical trauma, things like that, that all of those things are going to make it harder for a person to achieve full health and well-being. And so we want to offer this really comprehensive and really holistic whole person approach, particularly focused at people who have experienced more hardship in their lives in order to change our world. That's the ultimate goal. And then when we think about pain, again, knowing that the work in this echo is really focused on opioids, and where I think integrative PT has a really particular niche is in this approach to integrative pain care through integrative physical therapy. I love this image from the Alliance to Advance Comprehensive Integrative Pain Management, just because I think it does such a nice job of exploring the full range of what integrative pain care is, including conventional pain care. So integrative medicine, it's not alternative medicine. It's not an alternative to conventional care. It's about broadening our scope from including conventional care to things that we think of as maybe more in the holistic health realm, that we're allowing for all people to enter the room. It's a both and approach to care. And within that, again, within this image, the places where integrative PT is really set to influence, again, is that lifestyle work, looking at movement, nutrition, sleep, stress management. Mindfulness-based approaches are often a very strong component. And in fact, when we were talking about the guiding principles, there was a discussion of like, is mindfulness a guiding principle in and of itself? And we decided it wasn't, because it wasn't a necessary component, but it fits in really well. Again, that idea of connecting to deeper meaning through spiritual factors. And in PT, again, this is one of the things that sets PT up really nicely for integrative care, for that therapeutic partnership, is that we're required as part of our care plan to set very specific goals that need to be person-centered. So our goals that we create for our patients need to come from their driving concerns and what they want to get out of the practice. So again, it's very, the profession itself is really well positioned to be integrative, to do this integrative work, which is something in the Guiding Principles article, we kind of left it as a question at the end of the article of like, should integrative PT be a board recognized specialty, or is this just the direction that physical therapy is going? Could we like eventually see where all PT is integrative PT? Is this just where the field is taking us itself? And that's an open question. I don't know the answer to it. And then when we look even deeper into like the specifics of pain care within an integrative PT context, we can look at things like trauma-informed care practices and principles are very central to how we approach the person in pain. So it's a recognition of trauma, both in the patient and any traumas that the provider themselves has experienced and how that relates to that therapeutic partnership. I could do a whole talk on polyvagal theory at some point if you ever wanted me to come back and talk about that. But it's this idea of our stress response not just being in rest and digest and fight and flight, but that freeze response, and how kind of the full spectrum of our autonomic nervous system's response relates to how we process stress and trauma in our bodies. And again, from physical therapy, we're not looking at kind of processing the trauma through talk therapy. We're looking at how we actually process it through physical movement, through our body, through touch. And one way that this trauma-informed care approach shows up is in invitational language and asking permission. So when I see a patient for the first time, I always try and ask their permission before even engaging in lifestyle discussions, of saying things like, would it be okay if we talked a little bit about your life and aspects of your life that might affect the way you're feeling? And I've never had anyone say, no, I don't want to talk about it, but I still think it's good to ask permission. Or I'll say, before I physically touch a patient for the first time, I'll say, will it be okay if I touch your body to kind of assess how it's moving? And when the patient says yes, again, they've never said no. I think most people come to PT knowing that they might be touched. Then I follow that up with saying, if at any point the way I'm touching you makes you uncomfortable for any reason, please tell me, because it's very easy for me to adjust the way that I'm touching you. And that, I will say, people have told me in the past that the way that I was touching them wasn't comfortable for them. And I feel like by asking permission, I'm also opening the door to allow people to tell me when they're not comfortable. It kind of gives permission for that. So again, that's part of that trauma-informed care practice and principles. And then approaching it with cultural humility too, knowing that I see my world through my own life experience and my own cultural lens, and knowing that that is unique for me and may not be shared by the patient. And so trying to, again, uncover for them what's meaningful for them in approaching movement. Not everyone needs to be able to have the full range of their arm. Maybe their practice, what they are more concerned with is less about reaching up and more about, say, I've had plenty of patients who are Muslim who want to be able to get on the ground into a prayer position. That's more meaningful for them. So if that's the case, then I'm not going to work on reaching up. We're going to work on getting down to the ground. So things like that understanding what's meaningful for a person from their own cultural background. The neuroscience of pain is also a huge part of integrative pain care and integrative physical therapy for people who experience chronic or persistent pain. So helping patients uncover the links between stress and pain and an inflammatory response in their bodies, that's a huge part of what we do and how we, I often talk about it to people of re-befriending their body, which I'll talk about a little more on the next slide. Pacing is another really important factor when it comes to people who experience persistent pain. And this one, I will say, is often something that's disrupted pacing for people who have addiction issues alongside their pain. Perhaps, and again, I don't know this to be universally true. I'm sure it's not universally true, but I've seen anecdotally that people often, if they feel like their body, they want to do things with their body, they overdo it and then they pay for it, which is that sort of upper left corner, that overactivity, pain, fatigue kind of cycle. That cycle, people often turn to opioids to help relieve that cycle when they've overdone it and they feel terrible and they just need something to kind of help them get back into their lives. So teaching people how to recognize that cycle, again, we can get upstream of using the drugs and opioids for pain. And then the other cycle is really people who fear movement. So that's where we move less and then our body gets stiffer and weaker and then it hurts to move. So then we move less and our body gets stiffer and weaker and it hurts to move. So we move less. And that's another sort of dysfunctional cycle. So teaching people pacing strategies, which again, has to be personalized to their lives, about how to do a little bit of movement and then rest and a little bit of movement and rest in order to avoid those two kind of dysfunctional cycles around movement. And if we have time, I can give some good examples of some pacing that some patients have found for themselves that have been really helpful. And again, I talked about the complementary and integrative health modalities, including there's some interesting research around physical therapists incorporating some of the cognitive behavioral therapy for insomnia techniques in their lifestyle kind of education practices, with some good research behind it, showing that it's helping people sleep, which then is again helping with their pain and their overall feelings of well-being in their body. But this idea of kind of re-befriending the body is really at the heart of integrative PT in general, but particularly for people who experience persistent pain. And sometimes when someone will ask me, like, what's the difference between conventional PT and integrative PT? I'll tell them that, conventional PT is all about function. Like, that's what they want to do, is restore function. If your body is weak, you want to get it strong. If you can't balance, they want to improve your balance, like getting your function better, which of course, integrative PT, we want you functioning too, but we kind of have a deeper agenda, which is to really heal the mind-body connection, to really allow people to experience joy in their bodies, to fall in love with their body, and to really inhabit and be in their body, which is where this idea of positive embodiment comes in. Practices that help us reconnect body and mind, that we feel present and accepting of our body, and allowing our internal experience of our body to manifest in outward kind of behaviors and outward experiences that contribute to overall well-being. And practices that encourage interoception, which is our body's ability to sense the nervous system, like how our nervous system is activated in any given moment, our ability to sense and to regulate that response. So that, again, practices like yoga, and I would, yoga is my field, so that's where I know the research is, but I suspect that practices like Tai Chi, Qigong, martial arts, even some forms of dance, probably cultivate interoception in a similar way that yoga does. Anything where it gets us to tune in and listen to our bodies and like notice how our body is reacting to the world around us, and having tools that help us re-regulate that response. I know, Kurt, you were talking about gearing towards more what you're calling loud movement modalities, but like running or like big exercise. And again, when done with awareness, like that can be a mechanism towards interoception. And now we come to our fun part, which is where we get to take a taste and experience a little bit. So every patient who comes to see me, whether or not they know they're doing this, we work to some degree on a relaxed pattern of breathing, knowing that a slow, soft belly breath is going to have this, there's research that suggests that it can have a really profound effect on health and well-being, including things like improved heart rate variability and sympathetic or parasympathetic nervous system activation, decreased heart rate, blood pressure, anxiety, even like mechanically, belly breathing helps with reflux, because it helps to sort of strengthen the cardiac sphincter around where our stomach and our esophagus meet. Asthma, COPD, that's no surprise. But pain, belly breathing reduces pain. There's some really interesting research around oxygen saturation and how people who have been trained to breathe really deeply and really slowly can have these really interesting decreases in O2 sat in their periphery, but maintain high O2 sat in their central system. So it's just very interesting. Like, it's an efficient, it teaches us to be efficient in how we use oxygen when we breathe in this way. Again, I could do a whole talk on breathing, but for now, let's just experience it. So if you want, in whatever position you're in, you can do this sitting, standing, lying down, however you're comfortable. You can do it with eyes open or closed. And your hands could rest in your lap, or if you want, I'll invite you to put one hand on your chest maybe and one hand on your belly to really just notice kind of where your breath is sitting right now. So again, don't have to do anything special or anything fancy, just noticing when you breathe in, what part of your body moves, and when you breathe out, what part of your body is moving. There's no right or wrong at this point. We're just noticing where that movement is happening. And you might notice too, that as you start to tune into your breath, that already it starts to subtly shift and change from one breath to the next. You might also notice the pace of your breath, how fast or slow you're breathing. You might also notice that there's a rhythm to your breath, how long the inhale is versus how long the exhale is. Are they equal? Is one longer than the other? As you start to tune in and notice the breath, I'll invite you also to perhaps notice the ground underneath you. Maybe just sensing or feeling your feet on the floor or your legs on a chair. As you feel the ground, perhaps you allow your spine to lengthen just a tiny bit, particularly if you notice that your body is starting to slump, but without being too rigid about it. So we don't have to be super like hard and upright. We can be softly upright. And just noticing again how that's changing your breath. And if you'd like, I'll invite you to allow your breath to drop maybe a little deeper and a little lower in your body so that as you breathe in, you might feel an expansion at the belly. And as you breathe out, you might feel your belly soften back in. Sometimes we refer to this as diaphragmatic breathing, knowing that our diaphragm, that sort of dome-shaped muscle that's under our lungs, when we really use that muscle effectively to breathe in, it's dropping down, which means that our belly just needs to get out of the way. So when we call it belly breathing, really all that means is that we're using our diaphragm muscle a little bit more vigorously than perhaps we would naturally do. And maybe you notice too that your breath is starting to slow down. If you notice that, you could even lean into it, particularly slowing down the exhalation so that the inhales and exhales are of equal length, or maybe even your exhale is a little longer than your inhale, perhaps lingering on the exhale slightly. And if you'd like, you could just tune into anything else that you're feeling in your body. If you notice any other sensations, any aches or pains or tension, physical tension anywhere in the body. And if you'd like, you could think of using this breath, using these slow, soft exhales to soften any areas of tension or discomfort. So the way we breathe is neurologically linked with our fight, flight, and our rest and digest response. And when we engage in this deep, soft belly breathing, it's basically telling our body that we don't need to be in fight or flight. A fight or flight breath is up in the chest. And it's this idea that in sort of our evolution as humans, the regular diaphragmatic breathing, just like our rest and digest response, was supposed to be the baseline. And then when stress comes into the body, it's supposed to, like in theory, come in these like brief moments of stress that require a little more oxygen, that were sort of physical stressors on the body, things like literally fighting or fleeing, again, primitive humanity. And in that case, we need a bigger breath. We need our chest, we need our rib cage. And if we're doing aerobic exercise, we need a bigger breath. We need more than just the diaphragm. So that's when we will pop up into chest, shoulders, rib cage, or bigger breath. But most of the time in our lives, we don't need that extra oxygen. We don't need that extra breath. But because stress in our lives is no longer in these brief spikes, but it's often free floating high all day long, it trains our body to take these shallow breaths. It cuts us off from our diaphragm. But the way we breathe and our nervous system, the way they relate, it's like a two-way street. So if our stress changes in our outer world, it's probably going to change our breathing. But if we change our breathing, it's going to change the way our body is processing stress. It's going to give this shield so that the stress can stay outside the body and not drop in quite as deeply. And we know that stress and pain are like evil stepsisters, that they tend to like make each other worse. So anything we do to decrease stress will often decrease pain. And in the addiction world, we can also look at this as another kind of mechanism towards reducing craving, improving confidence and self-efficacy. When we can kind of have this direct effect on our nervous system, it's empowering. It shows us that we can really have control over our internal state, which again translates into the world of addiction really nicely. And if you're happy and you're like zoning in on this diaphragmatic, this slow, soft belly breathing, feel free to just keep it going. If you'd like, if your eyes were closed, I'll invite you to open them again. I did use an image of a cat on here, one, because I love cats, and two, because if you have a cat, a dog, or a baby in your life, they are beautiful breathers. So if you ever want a visual, like representation of what perfect belly breathing looks like, go to your cat or dog or a baby and see how they breathe. And that'll show you lots and lots of belly movement. And then I wanted to give a shout out for anyone who is interested in more of this work and more resources, that we've got a couple more echoes. I have QR codes here for them down below on integrative pain care and trauma-informed care. I'm going to be involved with both of those echoes, so you're going to be hearing more about this work through them, but we have a really fantastic team for both of them at Hennepin. So if you are interested in those, please check out those QR codes and sign up. Our nopainmn.org website is a great place if you're looking for some of those non-pharmacological providers across the state of Minnesota. If you're like, this is great, where do I find a yoga therapist? Where can I find, some Tai Chi or Qigong teachers? Like, it's all mapped out on that site. Again, the International Association of Yoga Therapy is another place to find yoga therapists in your area. And then some of these other organizations are places where my colleagues have trained in integrative, again, there's no school of integrated physical therapy because this is like a new thing. So we're getting our education at various other places. So some of these are places that I know that myself or some of my colleagues have gone for more education to help be on the forefront of this new specialty. And then I'd like to open it up for any questions. I put the website there for Integrative PT at Hennepin. If people have interest, you could just Google Hennepin Health Integrative PT and you can find the page. But I will stop sharing now. I see there's some questions in the chat already, so sorry that I haven't been monitoring that. I can look at it.
Yeah, there was actually one there that if you, she left her email just wondering how she could refer somebody. So,
oh, great.
Anybody have any questions that they've got?
I'm still here. I have 2 minutes and then I have to run.
Oh, perfect, Jennifer. Well, I can tell you now, if you that if you want a patient to get to integrative PT at Hennepin, you refer just the same way you would to any PT at Hennepin, but then you just write in the note that you want them to see integrative PT. And like I said, our specialty is really institutionalized. So they'll see that and they will know how to direct them. It's the same as like,
if you want them.
Yeah.
Bye.
Thank you.
Other questions before I start firing some at her here? Go ahead, anybody? I'm impatient, I'm thinking, Catherine, that sometimes you see somebody and there's just so much going on. Where do you start? And because the people often who have chronic pain, they're quite deconditioned, they're isolated, they're not doing anything, they have no connections. Where do you go with that?
That's a great question. And I usually will try and ask the patient, first of all, like I'll show them that image of all of the circles of like, here's all the things that could be influencing how your body feels and moves. And sometimes I'll ask them, like, where do you think we should start? Like, what feels like a good place for you to begin? So sometimes the patient has an answer. Sometimes they say, I don't know, everything hurts. It's, that. And if that's the case, I will often start with like saying, well, can we find like a comfortable position for you to rest like right now? So I'll look at rest often as a good starting point, particularly if somebody they hurt when they move, they're afraid of moving. Say, can we find a position where you can rest in comfortably? And so I use a lot of restorative yoga and kind of pillows and blankets and things like that to say, can we find a position of comfort at rest? and then we can work on moving from there. I'll also often start with the breath, again, knowing that that can help create more safety in the body. And again, that feeling of confidence, like, wow, I can really affect the way my body feels just through how I breathe. That often allows people to kind of then step to the next place and be like, okay, well, maybe I can move a little. So those would be a couple of starting places. One, it's just ask the patient. And two, if they don't have a clear answer, then looking at finding a position of rest and comfort and the breath, and then going from there.
Yeah, I would imagine that some of these patients are a bit of a project. I mean, I can't imagine that you can in 4 weeks kind of get to where you want to be. Is this how long-term patients are? How long-term are they typically?
So I usually tell patients that I don't see anyone more frequently than once a week unless it's a very extreme situation, mostly just because my schedule won't allow it. And I'm actually myself personally not seeing patients one-on-one at Hennepin. I'm only seeing them through my private practice right now because my work as program manager has gotten so big. I've been written into too many grants, basically, that they had to pull me out of clinic. But I will hopefully go back to clinic if the grant work ever slows down. But the other PTs are currently seeing people, and I don't think any of them see anyone more than once a week because our schedules just fill up, because it's not surprising. People want a whole person approach to care in general. So there's a lot of demand for our services. But that said, I usually tell people, if after 6 visits, you're not finding any benefit to this, I don't want to waste your time. But it depends on how long-standing their experience of pain has been. Again, it's probably true of most providers that, if someone's had pain for years and years and years, it's not going to end most likely in 1 visit or, 2 visits. It might take a little while longer. But if after 6 visits, you're not feeling any benefit, then I'll look at referring them out, maybe say, try acupuncture, or see, we'll brainstorm together to find a different, pool therapy is sometimes too something that I'll refer people out to if integrative PT just isn't working for them.
Yeah. And I don't think chronic pain is much different than addiction, where, we do see a lot of people that have experienced trauma when they were young.
Yeah.
How do you kind of ferret that out? Do you get more concerned about that if people just don't seem to be improving?
Yeah, and for sure. And like oftentimes stories of trauma come out in the first visit. We do a very long subjective intake. My first visit with patients is like 70 to 90% talking, to really understand where they're coming from and what kind of resources they have in their life, what they've tried already, and what their goals are, what they want to get out of the time with me. And to, again, establish that trust and that therapeutic rapport with the patient. So oftentimes stories of trauma come out during that initial intake, or sometimes they come out later as trust is built, and as patients start to kind of make connections between their history, their story, and their body, and how those two things interrelate. So, occasionally I have told patients, if you do not have mental health support, I think we need to figure out how to get you some, because I can't be a therapist in that sense, an emotional therapist. However, I do tell people that I hold space for emotional reactions, that we know that emotions, trauma, and memory are in our bodies. And I'm going to help create a container of safety where you can experience whatever it is that your body is experiencing, and that we can kind of hold space for that together. I don't know if that answers your question or not. I feel like I kind of went down a tangent there, but
yeah, Alana, do you just want to ask your question? I know you have a voice.
Yeah, no, I think you kind of started to touch on it when you're talking about that holding space component of it. The mental health, behavioral health part of it. If the patient does want to or wants to pursue that, what does that process look like for you to essentially coordinate what you're doing within your therapy with that behavioral health specialist?
Yeah. So some of the work that I do right now with patients at Hennepin is actually at our Red Leaf Center, the mother baby program. So our day hospital for mothers or pregnant people who are in a mental health crisis. And I am one of the PTs that does some trauma sensitive yoga with them. And so we will sometimes find, again, I say that same thing that I just said to you all, that we know that trauma and emotions are in our bodies. When we move, sometimes things come up that make perfect sense. Like I know exactly why I'm feeling what I'm feeling. And sometimes they don't make any sense in our minds. Like I have no idea why I just moved my body and now I'm bursting into tears. I don't, and so one, because that's a group format, I tell people that we're here to support each other. So if at any point you need support, we can all pause and provide support for you. Or if you need one-on-one support, I'm blessed with always having a social worker or a psychologist around, or a psychiatrist even around, that we can get some one-on-one help with. So in that environment, I'm very lucky, because there have been times where some of the people in the program have wanted to leave the room for one-on-one support. If I'm seeing someone in the clinic, I usually, and an emotional reaction comes up, the first thing I'll ask a patient often is like, are you okay? Like, do you want to continue what we're doing, whether it's movement or whether it's hands-on work? And do you want to continue? Are you okay? And if they say, yes, I am, like, this is what's coming up, then I say, like, okay, we can keep going. Like, if you're feeling safe, I've got consent from you to keep going. But if I get the sense that the patient is really out of control, like if they seem out of control, if they seem in extreme distress, I will sometimes just say, you know what, I'm not comfortable. You might be comfortable going on, but I'm not, because I'm feeling outside of my scope. And then at that point, I will usually pause and say, like, what can I get for you right now to help with your immediate needs? And, maybe it's a glass of water, maybe it's a blanket, something like that, of like, what kind of comfort do you need right in this moment? And then let's do some planning work around what kind of resources. And it's tough because, we all know that mental health providers are not easy to come by right now if someone does not have support. But I'm blessed with, I've never actually had someone who had an acute crisis who didn't also have a mental health provider in acute crisis while I was working with them. So I've always been able to then triage with their therapist, or strongly encourage the patient, if their therapist is not part of Hennepin's system, to follow up with them. And then I write a note to the referring provider saying, here's what happened. Here was my recommendation. Like, I'm going to follow up with the patient about it when I next see them, but I want you to be aware of it too. But I'm open to suggestions if anyone has ideas about how to do that better, because it's scary for me when that happens.
Yeah. I have one more question, and if somebody else doesn't come up with one, we're going to be able to let you go. But I think one of the biggest things, and again, I look at addiction and chronic pain, they're so much similar for many, many reasons, and overlapping, and isolation of these patients is just overwhelming at times. Often we're looking at ways to get people to get back out there, if you will. I mean, are there things that you suggest to patients with chronic pain, like joining groups for, the different ways of actually meeting people? Because again, motivation is often a problem. Opioids, affect all of that. So what thoughts do you have on that?
Yeah, well, I think particularly movement in groups is so healing and so powerful. And so I will sometimes pull up, when helping someone re-befriend their body and get moving again throughout the experience of pain is, we'll ask about, like, are there any like community classes or meetups or things like that would bring a sense of community to you with the movement. One thing, I do think it's happening again, I know it paused during COVID, but one unique place that the Twin Cities has is Dance Church. Has anyone heard about Dance Church before? I've never been, but apparently it's just fantastic. Like, it happens on Sunday mornings. I don't know, I can Google it and try and put in a link, but several patients have found like a ton of community through, it's like a Sunday dance that happens where they just play music, no talking. I think in the room where you're dancing, they encourage people to not use any words or speak. And it's about just like moving your body in a joyful way in community in a safe space. So dance church has been great for a lot of patients, very healing. Some of whom have very limited mobility. This is not hip hop yoga. Like they're dancing in their own way, in a way that feels authentic and safe for their bodies. It might not be like big, huge, crazy dance moves. But oftentimes like looking at getting a friend to walk or to move with, finding a supportive community around movement can be very, very healing for people and motivating.
Maybe the disco ball will come back
Yeah.
in your local church.
Yeah.
All right. Any other questions for Catherine before we let her go?
Hi, this is Marlene Wood. I was just wondering how the patient is able to pay for this. Do insurances cover it? Does Medicare cover it?
Yeah. Thank you for that question. At Hennepin, we take all insurance. And because again, like I said, in the PT paradigm, this stuff is all a part of our plan of care. So I, knock on wood, have received like maybe one denial around from Medicare one time, which I think had to do with, it was a wrist injury. And I think the payer thought that patient should be seeing OT and not PT for it. But I was able to write to their company and say, yes, it's a wrist issue, but here's why it relates to the shoulder and why kind of within this whole body approach, it is within my scope of practice. And then we did get some more sessions in that case. But otherwise, I haven't had, again, knock on wood, any denials, because I can clearly say we're doing this breathing practice that is going to influence their stress response to help decrease pain. And I can link it back to a functional goal around that I've written around. I want to see that the patient can, perform diaphragmatic breathing without cueing to downregulate their stress response to decrease pain. Or I can say in my goals, like, look, I want a patient to be able to identify 2 or 3 lifestyle issues that are impacting how their body feels and moves. And so then we do lifestyle education, and it builds in self-care and education, and it relates perfectly to their goal. So as long as like I'm connecting the dots, I've never had a problem.
Okay, thank you. Also, I'm in rural Minnesota, Elbow Lake, which is very small, close to Alexandria. Is there any type of therapists in the outer Minnesota area?
That's a great question. I'm going to write down the nopain.org, nopainmn.org in the chat as a place to look. Like that site has mapped out all of the PTs and all of the yoga therapists, okay, all of the Tai Chi, like providers. So I would say like, look through that list. I don't personally know of anyone. There are a lot of yoga therapists up in the Duluth area because there's a school up there that trains yoga therapists. But the problem is if you find just a yoga therapist, that's not going to be covered by insurance. You need a PT who also has a yoga background or an OT that has a yoga background, then it will be covered. So it's tricky. It's tricky. And like I said, I'm hoping that this work becomes more visible and more popular for providers to start practicing in this way, because patients are hungry for it and they have a deep need for it.
Thank you.
Yeah, thank you.
Well, and Catherine, thank you for coming back. Clearly, we'd have you back anytime you felt like you had lots of stuff to say again. So don't think we won't reach out. I'm sure you got lots more for us. So again, thank you so much for your time. Really great talk.
Thank you. Thank you, everyone. And yeah, feel free to reach out to me. I'll put my email in the chat here too, if anyone has any questions or follow up that they want.
Perfect.
Just catherine.justice@hcmed.org.
All right. Well, thank you, everybody. See you next week. Have a good week at work. Thanks again. Thanks, Alana, for your help today.
Take care.